our deck of slides. So we're done already with our first topic. Diba? Pero parang may kulang pa ba? Kasi alam natin we have two more topics to go. And so now we proceed to the next one. Equally interesting then. No? So our next topic for today is will be delivered by a former dean of the College of Physical Therapy at MCU, the head of the Physical Medicine and Rehabilitation at the National Children's Hospital. He is the head of the Physical Therapy Department at the Caloocan City Medical Center, a member of the PARM Specialty Board, and currently the chairman of the Board of Physical and Occupational Therapy Professional Regulation Commission. Okay, so it's none other than Dr. Eduardo Peregrino Jr. Good evening, Dr. Ed. Nice to have you back again.
Good evening, ma'am. Thank you for this kind introduction. Can I share my slides?
Yes, Doc.
Okay. Good evening, everyone. 45 years ago, the work from home setup is usually rarely done or conducted. And with the advent of the pandemic, the online platform that we're using right now has changed or improved or increased in the usage drastically. So all of you will agree with me because of the pandemic. We also had the lockdown pandemic and also the pandemic of immobility. Because of that, there was an increase in the
This meeting is being recorded.
to moderate disability, 13% will experience moderate to severe disability. The absences. And also companies will be complaining if you see an increase of these kinds of conditions and increase absences because of disability. Okay. The most common single nerve form of neuropathy is your carpal tunnel syndrome. It's a neuropathy of the upper extremity associated with the compression of your median nerve. Actually, sometimes they call it a musculoskeletal conditions. However, this syndrome does not affect the soft tissue, but affects your median nerve in the upper extremity. Okay, so this is caused by anatomical changes and genetic predisposition of your the wrist. Okay, so it sometimes the swelling and the inflammation and other contributory factors like hypoglycemia, hyperglycemia, diabetes mellitus, and obesity. Also, injuries in the wrist like yung strain, sprain, dislocation, or fracture can cause your carpal tunnel syndrome. Okay. However, there's an increasing incidence of yung ating repetitive or common repetitive conditions occurring on the wrist. Okay, so repetitive movement like this one or prolonged posture like this can also increase the incidence of or the development of your carpal tunnel syndrome. So what are the usual complaints of these patients? Usually, patient will come in because of weakness or yung weak yung kanilang grip. Sometimes they will just mention at pag umiinom po ako, biglang nabitawan ko yung baso na hawak-hawak ko. They also will complain of pain or numbness in one or both hands, pins and needles or paresthesia, a swollen feeling of the fingers, burning or tingling sensation in the fingers, especially the thumb, the index and the middle finger, and also yung ating ring finger, yung kanyang half ng ating ring finger. Pain or numbness that is worse at night. Sometimes the patient will wake up complaining of pain on the wrist or numbness or tingling sensation on the wrist. Okay, and sometimes the patient, when you try to ask the patient, prod the patient, you will see a flick sign, sabi nila, flick sign. When the patient experiencing numbness or paresthesia, when they try to shake their hands, some form of improvement will occur on those patients. So nawawala or nare-relieve nila yung conditions nila when they perform your flick sign, like this one. Okay, so next we have your cervical radiculopathy, okay, sometimes called your pinched nerve. It's a condition that results in radiating pain in the muscles and weakness occurring on the upper extremity. So, for example, pain coming from the neck will go to the shoulders and also will affect your upper extremity like your arm, forearm, and your hand, down to your hand. It is sometimes caused by compression and inflammation of any nerve roots in the cervical region. So, men are usually susceptible in the development of your cervical radiculopathy more than your women or the women. Risk factors include heavy manual labor requiring repetitive lifting, also smoking, driving, okay, operating vibrating equipment, neck trauma like coming from the sports or motor vehicular accidents, and also previous spinal nerve injuries. The two main mechanisms usually identified with your cervical radiculopathy is one is your spondylosis, or which leads to stenosis or the formation of your bony spurs. Okay, so this condition or mechanism is commonly seen in the older individuals. Also, this herniation or HNP it can be seen more commonly in younger patients. Another risk factor or mechanism injury, and if patients usually experience a sudden onset of this condition or that pain or radiculopathy, sometimes we correlate this with a trauma or underlying traumatic conditions. If it is insidious or slow onset, sometimes we relate this to common musculoskeletal conditions or yung ating mga repetitive trauma or small injuries that are performed regularly. Okay. Also, if it is progressive in nature, sometimes we correlate this one with degeneration or tumatanda or wear and tear. Common symptoms usually, if it's check it if it's immediate or insidious. Sometimes immediate if it's traumatic in nature, insidious in slow onset sa kanila. The patient will always complain of, or more often than not, will complain of radiating pain from the neck into the shoulder blade and down to the arms. Patient will complain of numbness in the upper arm, forearm, up to the distal portions of the extremities. Sometimes they will complain also of weakness. Sometimes they cannot elevate their upper extremity if the condition has worsened. Neck pain and limited range of motions will be a common complaint, especially in older individuals. Decrease in the muscle length of cervical spine musculatures are also seen, especially in the trapezius, scalene, and levator muscles. Joint stiffness, capsular thickness, and also postural defects are a common symptoms or usually seen in these conditions. Okay. Do you know that your cervical radiculopathy and carpal tunnel syndrome can also occur at the same time? Usually, we call this your double crush syndrome. The underlying condition for this one is when a diseased nerve or a nerve undergoing irritation are sometimes sensitive to further stimulation. So, for example, patient has cervical radiculopathy, so there's an instant that the patient will develop also carpal tunnel syndrome. And also in my practice, I try to check if a patient was diagnosed with carpal tunnel syndrome. I also check the neck region. I perform the special test to check if there is also cervical radiculopathy. More often than not, more than 50% of cases na meron akong cervical radiculopathy, patients also develop carpal tunnel syndrome. Okay, so in addition to the diagnosis of your neuropathies, okay, you should also you should prod patient on the medical history, check the onset of this one, if it is a recurrent or there's an abrupt onset of this condition. Okay, for carpal tunnel syndrome, you have to check for symptoms in the hand. Usually, patient will complain of paresthesia in the digits, and most commonly occurs in the thumb, index finger, in the middle finger, and half of your ring finger. Okay. In addition, you can also perform Phalen's maneuver and Tinel's sign. Okay. For cervical radiculopathy, we try to elicit or try to promote compression and distraction on the cervical region. So we can perform yung Spurling's test and other tests on the shoulders and the neck region. Also, Valsalva maneuver, neck distractions. Okay. So we try to increase the tension on the neck or try to relieve it. So if we try to increase the tension, dapat yung symptoms ay lumalabas or mas lumalala. If we try to release or try to distract the area, okay, cervical distraction, so sometimes the symptoms will go away or the symptoms will improve on these patients. Okay, for further diagnostic checking on their patients, we prefer to use EMG and NCV. Actually, this is a definitive diagnostic modality to check if there is really nerve irritation and there is muscle weakness. Okay. However, sometimes patients doesn't like to undergo this type of diagnostic modality, since that there's a lot of injections. Okay? Parang yung needles will be stuck on the patient's skin, okay, or yung kanilang extremities nila, and also yung parang small electric shock, okay, being used for electromyography and for your nerve conduction studies. But to really check if there is impingement or there is nerve irritation or a decreased function of your peripheral nerves, a definitive diagnostic modality is your EMG and NCP. Also, to help us in our diagnosis, we can also request for imaging studies like your X-ray, your magnetic resonance imaging to further see the soft tissues surrounding that area. A CT scan also will be helpful and also to come up with a more defined architectural studies of your bony structures. And recently, there's an increasing use of your ultrasound or your musculoskeletal ultrasound. Right now, your MSK ultrasound can detect if there's inflammation of your median nerve in your carpal tunnel. Also, this can also check if there's an increase in the pressure in your carpal tunnel. So it's an increasing diagnostic modality being used by medical practitioners already. Okay, after the diagnosis of your patient's peripheral neuropathy, we now go to your treatment options. So we start with surgical management. So we can provide medication or give medications for the pain, for the radiculopathy and numbness. You can also, as a rehab practitioner, I subject my patients to undergo physical therapy. And if the need requires, I will prescribe splints or braces on my patients. For the medications, usually I will initiate with a pain reliever. So I can give non-steroidal anti-inflammatory drugs. Also, I can also provide or give patients steroids. For the anti-seizure medications, usually we can give your pregabalin and your gabapentin. Your pregabalin and gabapentin are membrane stabilizers, so they can help relax your diseased nerves or help decrease the irritation of your nerves. But remember, your pregabalin or gabapentin, their label, they are used for seizure medications. So the effect of your pregabalin and gabapentin in your peripheral neuropathy is an off-label use of these medications. So next we have your topical treatments, like your lidocaine cream, topical NSAIDs, and also there's an increasing use of your capsaicin cream. And next would be your antidepressants like your amitriptyline and your duloxetine. These medications can also help in the relaxation or decreasing the irritation of your nerves. And lastly, we have your vitamins like your B12 and your mecobalamin. Okay, for the splints and brace, usually we try to protect the area. If it's a traumatic injury, we try to immobilize and protect it. So we can also use it for your wrist. So we can use your wrist splints. However, okay, we try to balance the use of your splints kasi pag sobrang tagal naman natin ginamit, it can also cause stiffness or weakness or further weakness. So we try to limit the use of your braces and splints in our patients. Also, when patients with carpal tunnel syndromes, sometimes I ask the patient, so kung sa gabi ba nagigising kayo? Usually kasi when we're sleeping, we don't know what's the position of our wrist. And this position, yung ating flex position ng wrist natin, it increases the pressure in your carpal tunnel. And sometimes increasing the pressure in that area will promote further irritation of your median nerve. So pag tutulog tayo, hindi natin alam position, pwede nakaganyan ang kamay natin, or nakaganyan. So to help protect our patients during sleep, we sometimes provide them night splint. So parang tutulog sila sa gabi, nakasplint sila dito, nagamit ito, para nakaganyan sila. Okay? So your splinting is usually, if there's a need, if it is required, this can be helpful to your patients. Okay. Also, if we provide exercises for this one through your physical therapy. So meron tayong therapy for your carpal tunnel, and we have your physical therapy for your cervical areas. Okay, so the main principles underlying your with physical therapy with your peripheral neuropathies is try to relieve inflammation by providing physical modalities, yung warm, yung cold treatment sa kanila. Also trying to mobilize, like improving the range of motion, stretching, and manipulation to improve this the disease areas, like to help relieve your stiffness in those areas. Also, in physical therapy, they try to provide exercises for strengthening or try to provide exercises for mobility. Okay, this can help your patients. Okay, with physical therapy and surgery, sometimes surgery confers greater reduction in pain in the short term. However, when you teach patients with exercise, when you teach patients how to mobilize and to try to promote movement in that area, there's a much better outcomes and better prognosis for your patients. So, minsan kasi, may mga nakikita kong pasyente na after surgery, hindi sila nag-exercise. And still, they do the usual activities. They don't perform regular mobility activities. So, bumabalik din yung conditions. Okay. But if the patient opts for surgery, sometimes for cervical radiculopathy, they perform anterior cervical discectomy and fusion. For carpal tunnel syndrome, usually they perform carpal tunnel release. So they open up this area and try to remove the constricting the soft tissues that's constricting your median nerve. Okay. So in addition to your medications and your therapies, there is also this increasing use of your alternative therapies. Number one is your hydrodissection. So ultrasound guided ito, usually rehab doctors and orthopedic surgeons usually release this non-surgically. So mag-inject lang sila dito in that area, try to inject D5 water or other medications to release the compression on your median nerve. This more usually used in median nerve, less used on the cervical region. Also, makikita kayo na there's an increasing use of acupuncture. In my practice, I allow the use of acupuncture for pain, but not for the other effect of your acupuncture. Basta for me, usually pag nagka-subject sila with acupuncture, nare-relieve naman yung complaints of the patient for the pain. Also, for for relaxation, we try to promote the use of your yoga and other meditative treatments or strategies. So remember, when your nerves are irritated, so diba, stress sila or anxious sila, so when you try to promote relaxation, sometimes the brain relaxes and also their nerves also becomes relaxed. Okay. With that also, we try to promote lifestyle modification for neuropathy management. So ergonomics and workspace design. So commonly, pag nakita, minsan pag umiikot ako sa mga offices, nakikita ko yung mga pasyente na kayo po, tapos nakaganyan. Okay? Kanina, no, nakita ko rin sa videos natin while observing some of this one. So yung iba parang nakaganyan sila. Okay? So we try to promote ergonomics in the workspace, also improve the proper posture and body mechanics. Remember that your carpal tunnel syndrome and your cervical radiculopathy is usually brought about by poor posture and prolonged poor posture. Okay? So we try to promote regular breaks and stretching.
This meeting is being recorded.
In vegetarian, may need fortified food supplementations. Okay, so mga puro vegan lang. Exercising regularly, aiming for at least 30 minutes to 1 hour of at least 3 times a week of daily activities. Or sometimes yung ito yung magtakad ka lang, tumakbo, or umakyat baba, at least 30 minutes. But I keep on reminding my patients that exercise, Doc, naglakad po ako ng 10 minutes galing po sa MRT papunta sa opisina. Doc, naglakad na po ako ng 30 minutes galing sa bahay papunta ron sa aking trabaho. Okay na po ba yun? Okay. So those activities are not exercise. Those activities are your regular activities. Maganda sila if you don't have any activities, yung heart mo okay. But for a person to call it an exercise, dapat in regularity, okay, merong frequency, time-bound sila. That's your exercise. And usually, you do it out of your ordinary activities. Okay. Also, avoiding toxic chemical, smoking, and heavy alcohol, as well as repetitive motions and cramp positions that put pressure on the nerve. Okay. Not included here is water intake. I suggest that at least an individual, okay, should consume 2 liters of water per day. Water, ha? Clear water, hindi yung 2 liters of coffee, 2 liters of milk tea, other activities or other fluids. Okay. Also, there's a discussion in the Mayo Clinic that to prevent neuropathies, okay, so adults over the age of 50 years old should be vaccinated against shingles. Okay. In relation to our discussion today, so vitamin B12, not all vitamin B12 molecules are equally useful, okay, to our patients. Okay. So remember that a B12 should be preferentially transported across the blood-brain barrier. And also, dapat readily available siya in the areas that it is needed. So, sa serum and your cerebrospinal fluid. Among the 3 types of your vitamin B12, mecobalamin has a higher concentration in the serum and your CSF compared with your hydroxycobalamin and your cyanocobalamin. Okay? So, mas gusto mo, di ba pag tatayo ka ng bahay or nag-repair ka ng bahay or you're repairing something, you want your resources, yung ating mga replacement, yung ating supplementation should be readily available rather than waiting for a long periods of time, okay, and jacking up on other supplementations that just to achieve your target levels of your supplementation. Okay. Also, your methicobal also helps promote the production of your lecithin. Lecithin is a major component of your myelin sheath, and a healthy myelin sheath can help protect your nerves further, and also it can help in the repair. Since it's protecting the nerve, also it can guide your nerves while it's repairing. Okay, so as a summary. Okay, I was able to discuss about your the two most common peripheral neuropathies, which is your carpal tunnel syndrome and your cervical neuropathy. Also, I was able to share the symptoms and treatment and how to diagnose your carpal tunnel and your cervical radiculopathies, and also an additional updates on the treatment of these conditions. With that, I'd like to thank you for your time. Hope I was able to share my knowledge with you. Thank you.
Thank you, Dr. Ed. So you were able to share a lot of your knowledge with us. Definitely. These conditions, all these MSDs, of course, we do have a very large number of these cases in the workplace. As a matter of fact, according to the PSA ISME, among the top 3, dalawa doon ang MSDs natin. And actually, mga carpal tunnel syndrome and other neuropathies, this is also very common in all industries, not just in that of the manufacturing, BPOs, even sa mga construction. Kahit sa ang establishments talaga. So, sigurado lahat ng mga attendees po talaga natin dito, naka-encounter na sila itong mga ganitong cases. No, that's the reason why, Doc Ed, this is also included in our course, in the basic course in occupational medicine when we are doing the training. So, kasama talaga siya because it is also one of the programs that we do in our workplaces. Even that this is also, ayun nga, yung top 1 talaga namin sa mga medical conditions in the workplace. Now, medyo natuwa ako nung na-mention ni Doc Ed na while he was listening to the first lecture pala, nag-o-observe siya kung ano yung ginagawa ng ating mga participants. So, huli kayo, no? So, that's the reason why we really have the basis of talagang yung ergonomics, Doc Ed, is talagang important for us to be able to impart to all our all the workers, not just for us doctors. Of course, we're going to share this with our workers as well for them to be able to prevent these conditions. No? Ang question dito, meron akong phone-in question. Although, teka, silipin ko lang, Doc Ed, ang ating chat group because may kasalanan ako kanina sa first session. I was not able to see that there were a lot of questions pala earlier sa dami ng mga lumalabas sa ating chat. So, dun po sa mga questions kanina that we were not able to answer, don't worry.
You give the patients sometimes improve already. And after 2 weeks to 4 weeks na walang improvement, you share them with us na. So we can add further management of these patients.
Thank you, Dr. Ed. Oo. Kasi ako minsan, 1 week pa lang, nire-refer ko na. Kasi these patients, we see them every day, no? Unlike kasi pag nasa clinics kasi tayo, we see our regular patients. We only see them for follow-up. Pero pag sa company po kasi, nandun sila, so araw-araw namin sila nakikita. So, kaya kailangan talagang medyo mas aggressive tayo. We have a question here, Doc Ed. So are all mecobalamin preparations equally efficacious in the management of neuropathies?
Okay, it depends on the mecobalamin. For example, syempre with our sponsors, it's effective. Usually the mga originator drugs kasi like yung what we're using right now, the mecobal, it's effective with our patients. And syempre yung mga succeeding types, nagbabago na kasi yung kanilang mga components nila. Sometimes hindi lang naman dahil sa effectivity, sometimes yung side effect nila. Sometimes they cause hyperacidity, sometimes yung alam mo yung panlasa nila, nagbabago yung panlasa nila. So these are the ones, hindi ko naman sasabing they are lower in their class, but kasi time and tested na kasi yung ating mga yung meticobalante with this one. So okay, sa akin kasi yung with my experience, okay siya. But yung iba kasi na minsan, halos pareho pero magkaiba. Merong ibang mga napapansin kasi pasyente, lalo na yung mga chronic users na. Dok, nung binigay mo ko ng bago, parang sumama yung pakiramdam ko, yung mga ganun mga conditions. That's why I try to stick ko ano yung gamit ko na medications, supplementations.
Yes, agree. Oo. Kasi ano rin that's where we get our patients' trust. kung talaga napapagaling sila, ayaw nila ng lalo na kung medyo matagal, tapos paiba-iba sila ng gamot, no? Parang tipong they are losing their confidence in us. So, agree, Doc, and thank you very much for that advice. So, another question that I have here is, may tanong kasi. So, given a component nga siya ng vitamin B12, is it okay that pwede rin ba na alongside with the mecobalamin, umiinom pa sila ng B-complex?
Usually kasi, meron akong mga pasyente na chronically taking these medications. Minsan, hindi lang isang tablet, minsan 2 tablets, minsan 3 tablets, 4 capsules sila per day. Remember, kasi meron tayong itawag na vitamin B complex radiculopathy. Meaning, the patient is excessively taking high amounts of your vitamin B complex. Sometimes it can cause injury, further injury to these patients. So, pag nakakita ko minsan na sobrang dami ng vitamin B complex, tanggalin mo to, or consume mo na lang to. We try to maintain one lang. Kasi when you're giving medication, too many B complex to your patients, minsan hindi mo na alam kung ano yung gumagana. So, pag nakita ko sa kanila sa referral, usually, cancel natin muna to, tanggalin natin muna to, dito lang muna tayo mag-stick. Then if this is not improving, we try to add or we try to change this medication. Yun nga, I'm welcome with introducing your parang giving additional, but I am worried also that we're giving too much or excessively B complex to our patients. Yun lang aking worry sa pasyente.
Yes, agree talaga. I myself, I was able to encounter those also, Doc Ed. Pag nag-history taking ka, magugulat ka namin nilang iniinom na gamot pala. No? So, lalo na over the counter din kasi most of these medications. And with that, I think, no, kasi very well explained naman, very comprehensive kasi yung discussion ni Doc Ed. So, wala na tayong mga questions dito sa chat. I would like to just make a summary. So, mga key takeaway natin for this discussion. So, Doc Ed was able to discuss about course, the causes of the CPS, management, and important thing is the strategies for the prevention. Lagi naman tayong gano'n, di ba? In any setting, lalo na sa occupational medicine, is nandun tayo doon sa we would like to prevent it from happening. When it's already there, then we treat, we manage, we control, no? And then prevent it from happening to other people. Lalo na kung halimbawa makikita natin, work-related pala siya. Ang nagkakos pala ng compression syndrome niya ay dahil doon sa ginagawa niya, no? And that's the reason why also ergonomics, we really have to keep on having programs, good programs on ergonomics in our workplaces. And with that, Doc Ed, once again, thank you very much for imparting with us your knowledge. No? So makakatulong po talaga no, malaki sa aming practice to, no, in our respective clinics. Thank you, and we hope to see you again in the future, Doc Ed. So si Doc Ed is lagi nating nai-invite din. So isa yan sa mga favorite nating speakers. Thank you very much, Doc Ed, and good evening.
Thank you very much, po.